What advice do you have for people that are still in school for public health and that are trying to find a job?
Network, people graduate from the same program before, to talk to them, and then they will give a lot of different advices. Maybe they will refer you for the company they are working with.
I say really start to understand what your professional story is. Understand what worked, what you want to do again, what you never want to do again.
Yeah.
And I tell people, practice telling your professional story to a 5-year-old at Thanksgiving dinner table. Once you can get a 5-year-old to stop saying, well, what does that mean? You can go ace any job interview.
I'm working on a social media as well. I just want to share my experiences, especially as an international student in public health. So funding cuts and then the immigration things happening now. So it's so hard for our international students to land a job here.
Hi, everyone. Lena Clark here, the host of the Sunflower Squad podcast, brought to you by Sunflower UX. We are still out here at New York Tech Week, as you can see. Another beautiful view. So this morning was Bonnie's investor breakfast, but there are so many amazing events going on. And the reason I love that is because I get to meet so many other amazing, talented people. So let's jump into our conversation for today. Would you like to introduce yourself?
Yeah, hi everyone. My name is Jiseng Yen. Currently, I just graduated from my public health degree at Columbia just 2 weeks ago.
Yay!
And then also I'm another podcast host. We call a cafe, and then we talk about education and then personal growth.
Yeah, and so I'm so happy you came up to me.
Yeah.
Everyone, we've been chit-chatting about public health. We've been chit-chatting about just all the things that people can do to keep growing. Tell me what you studied for your public health degree.
Yeah, actually, I'm under the health administration's kind of like certificate. When there are a lot of like hospital with health insurances, how to do the operation, like finance stuff. And then all of my classmates are going towards healthcare industry, like hospitals, health insurances, or healthcare consulting. Yeah.
Yeah, that's awesome. So on my side, I did public health, but I was doing the occupational health and safety side. So looking at how to hopefully keep people out of the hospital, honestly, like while they're doing very serious jobs. Most of the people I graduated with went on to work in like oil and gas or manufacturing.
Especially in Texas, that makes sense.
Especially, yes. Especially, as y'all know, I'm an Aggie, and so oil and gas and Texas A&M are like this.
Yeah, fast.
But I found out during grad school that I don't like wearing blue jeans every day. So that's why I'm not in a factory right now. I loved everything else about it. I just didn't want to wear blue jeans every day.
That totally makes sense.
You just graduated. So what's next for you?
Yeah, I'm gonna work in life science consulting for my career because after graduating from the school, I feel like I want to learn more skill sets. Consulting is a good place for me to kick off my career.
Consulting.
Like, soft skill, like problem solving, personally, how to collaborate with different people like you guys, like that's exactly the thing I want to learn after graduating from my degree. And also healthcare industry to help with the patients.
Yeah, and I feel like the healthcare industry is really rapidly changing right now. So this is an exciting and needed time for more people to be getting into it.
Yeah.
Putting their fingerprint on things.
Yeah.
What advice do you have for people that are still in school for public health and that are trying to find a job?
Yeah, I feel like this is a good question. I feel a couple of things. First of all, we are studying at a school. We definitely learn a lot of like the knowledges, especially in healthcare, so different, so difficult. The payers, who gonna pay for different services.
Yeah.
So we're gonna use the time to learn. And second thing is like a lot of soft skills, to try to go on so many events. Like these events, you know a lot of people who are already working in this industry and do a lot of case competition, just put it out there to try to talk to like senior people and then share your knowledges. Network, people graduate from the same program before, to talk to them. And then they will give a lot of different advices. Maybe they will refer you for the company they are working with. So yeah, I feel like that's a good advices I will give to the students who are still in the school. Any other advice you want to add on?
Yeah, so I love everything that you said. I'm a +1 on all of that. I say really start to understand what your professional story is.
Yeah.
I've noticed a lot of college students, especially once you get to grad school, there's something about it. You start to doubt the journey, the path that you're on.
Yeah.
and you think, oh, well, everything I did before this, it's not what's going to get me to the next thing.
Yeah.
But there's something about everything you've done up until this point in your career that you were either the right or wrong fit for. Study that. Understand what worked, what you want to do again, what you never want to do again.
Yeah.
Learn how to tell that story. And I tell people, practice telling your professional story to a 5-year-old at Thanksgiving dinner table. Once you can get a 5-year-old to stop saying, well, what does that mean?
Yeah.
What does that mean? You can go ace any job interview.
Thank you. I'm gonna take that. It's really helpful.
And then try to get your parents to understand. My parents don't understand what I do still, but one of these days I'll get good enough at telling my story that they will understand.
Yeah.
So you just graduated, you're starting consulting. Is there anything else that you're working on?
Yeah, actually, I'm working on a social media as well. I just want to share my experiences, especially as an international student in public health.
Yeah.
So funding cuts and then the immigration things happening now.
Mhm.
So it's so hard for our international students to land a job here. So I post a lot of like my experiences, how to network. I'm not really familiar with American like small talk culture, break the ice, talk to different people. So I'm just doing that now before I just actually start my job. I feel like it's a good time. I'm really free. So just want to share my story to different people.
What I love about public health is that we always have so many international students.
Yeah.
And it makes it a very rich and strong field because we're getting these different perspectives. These cultures are truly coming together as a melting pot, which melting pots of cultures are very good things.
Yeah.
It helps all of us.
Yeah.
And so I love that you're sharing your story. I'm sorry that your story is what it is right now, but it's wonderful to use your platform to show other people what is going on.
Yeah.
And let me tell y'all, if you think I'm a great researcher, which I am, I can tell you so many of the international students that I've worked with over the years, they're phenomenal. They have so much to bring to us and we have so much to give to them. So if you're in charge of funding decisions or if you can help someone network, please do that. Please use your power because we need it.
Yeah, we definitely need it.
Yeah.
Yeah, we need help.
Yeah. My hope is that with everything going on with the cuts in public health funding, is that everybody's going to come together and realize that we are all better when we are doing research, when we are building healthy communities. So I have a lot of faith in everyone. I know that we're all strong communities.
Yeah.
But yeah, thank you for sharing your story.
Thank you so much for having me. I really appreciate it.
Yeah, please check out his podcast. And thank you everyone for tuning in. Bye.
Yeah, bye.